Hello, everyone. Welcome to Stroke Warrior Radio's Roz and Clay Show. Another eventful, eventful day for me. How are you all doing today?
We're doing great. So happy to see you.
You too. You too. It's been too long. So today, we've been talking about this for quite a while, and I'm glad we're finally doing it. We're going to go through. In the beginning, weren't told a lot. So we're coming up with 30 questions in 30 days. And it may be more than 30. It's frequently asked questions that we should have known at the time. And and the reason it excited me to do this was when you told me about the electric toothbrush. I mean, I would have never thought of that. I still didn't think about it, you know. So
Oh my goodness.
we'll get started from that at least seed that was planted for me. So, Roz, what do you got?
Love it. Okay. So as my tenure as a special education teacher, I infused all of my parent training and I came up with a sensory toolbox. And this is a sensory toolbox I would teach my parents. I would go into the home and teach them how to transition their child who just received, out of the hospital from a stroke or seizure disorder, but an incurable diagnosis. So it's very traumatic. The parents have PTSD, and we realized that we had PTSD. I mean, we all, as stroke warriors, we have all suffered a medical emergency. So we're going to hit on those points, the transition from PTSD, because that affects our mental health. And we don't realize it. We didn't realize it. And Clay is in the military. They have PTSD training. And then one day he realized, you know what? Because I told him, I said, you have PTSD. He would not leave me alone. He and my daughter were following me to the restroom. They were scared to leave me alone because my stroke happened when there was family at the other end of the house. And so we realized, and in this support group meeting the other day, when I was listening to other stroke warriors, I realized they still have PTSD. Yeah. I mean, the new stroke patients that have been home for 2 weeks, they have PTSD, but I could hear it in stroke warriors that had their stroke a year ago. They still have PTSD. So we need to work through that. We're not in a medical emergency. We're transitioning home. So the sensory toolbox, so y'all get your note, y'all take notes. It's a sensory toolbox, and this is something we all have in common. We all have eyes, ears, nose, most of eyes, ears, nose, right? Taste and touch. So I'm going to hit on those points, and Clay will jump in, and I know you will too, Ralph. So let's address the sensory needs. And I know we all have sensory issues. Let's just put it that way. We all have sensory issues. We all know things that are pleasant for us. So let's start with vision. The neuro-ophthalmologist. Now you wear glasses, Ralph. I wear glasses, but again, stroke warrior meeting, there were other people that had lost vision. I lost my lower left, what's that called?
Lower left quadrant.
My lower left quadrant.
Not only that, is your center line shifted. So if you come across a stroke patient that can't walk in a straight line, it may not necessarily be a balance issue with their inner ear. It could be that their brain no longer can sense the center of their vision. Right. And that's where the neuro-ophthalmologist was able to test and told Roz she had a 7-degree shift in her center line. So her straight she was always walking to the right.
But see, it's because I was walking in the walls and the therapists were yelling at me, why are you walking in the walls on a walker? And I didn't have the sense, I didn't have the cognition to tell you, hey, my vision is off, because I'm just trying to get through the day. I'm just trying to walk. I'm just trying to stand for 30 seconds. So
Right.
we're all in, right? We're all in PTSD mode. So our brain is still jumbled. So a neuro-ophthalmologist, I want to address the fluorescent lights. I did this with my students who are mostly nonverbal. They come in the classroom and they would start crying or screaming. Well, as soon as I cut the lights out, I'm looking around. What's affecting their senses? That's what we all always need to ask ourselves when we're tired and cranky. What kind of input are our ears taking in? Are our eyes taking in? And our eyes, I start crying when I think about the
Yeah.
vision. So fluorescent lights, there's already enough research to prove that fluorescent lights are very harsh on our eyes. And if they're harsh on our eyes, they're harsh on our brain. It's almost a neurotoxin. So people don't realize they're working in fluorescent lights and they're tired all day. Well, that's because the fluorescent lights are giving you a headache or making you tired, but you don't realize it because you're focused on your work. So when you go home, can you control the fluorescent lights, the lighting? Clay had to put drapes up. When he came, every room that we go in now, that's why I'm wearing a sun hat inside, because I have these fabulous lake house windows. All this natural lighting is coming in, but it's affecting my eyes. Again, the brain tells the eyes what to see. We're all taught through the optometrist that the eyes tell the brain what to see. No, the brain is processing what your eyes are seeing. Do you guys see the difference with that? So
That's the brain injury part of the eyesight. Yeah.
exactly. And not everyone comes out with photophobia like I did. So an eye mask is an excellent sensory toolbox. I wear it all the time. We travel to the doctors. I wore it the whole time in the RV because that blacks everything out. But also, when you go home and in the hospital room, do you have pleasant sights? As caregivers, picture something familiar that would trigger something pleasant, that would trigger my vision, which would trigger my familiar brain pathways. Our familiar brain pathways are deeper than the pain ones. But the pain ones hurt, right? Because we just went through PTSD. So again, surround your stroke warrior with pleasant sights, whether that be pictures, and no television.
Okay.
No television. When I was at UT Southwestern, and I call it stroke recovery boot camp, I'll be going back and forth with that. Not one, it was a 42 bed, leading edge, state of the art facility with a 24/7 rehab nurse, 7 days a week therapy. The social worker was on Monday through Friday. Psychology was available Monday through Friday, and care coordination was available Monday through Friday. It's intensive rehab, 3 hours a day, 5 days a week. And I had to get a referral, my doctor referral, and they interviewed Clay and my daughter because I couldn't have contact with them. That's why I call it boot camp.
Yeah.
I could not have visitors, and I could not have them calling me, and I could not have a cell phone. So you take all those distractions away, and all I had to focus on was my therapy. And so what they taught me, Ralph, is really managing my space. And at that time, my only space I could manage was my bed, which was a big deal, right? Because you got one hand, so that's why they took away the phone. Now the phone was across the room on a table, and they would not push it over to me. I could not, again, no communication. But because the family is also going through PTSD, right? Families know, are as parents as well. That brain kicks in, our caregiver brain kicks in. Oh, this is best for my spouse, or this is best for my daughter. This is best for my son. Well, no, it's not. They're going through PTSD and struggling. Everyone's scared and struggling. So no one's making logical decisions. They're all emotional decisions based on pain, right? And panic.
Yes, absolutely.
Now I'm surrounded by a medical team. And as a special education teacher, I spent my whole career creating individualized educational plans, or IEPs. And that's exactly what this stroke rehab facility did. They developed a plan with all the therapists, speech, OT, PT, the psychiatrist, a dietitian, of course, obviously the neurologist, the social worker, the care coordinator, and the parent trainer. It was the best thing ever. And we met weekly as a group, and they talked about me, just like in an IEP meeting where I would talk to the teachers, all the, what do you call those? All the stakeholders at one time, and we impact my individual needs and the solutions and what they tried. So did I feel like a guinea pig? Absolutely. But I was a happy guinea pig because as a teacher, I knew what this did, because that's what I did for my kids. I work with physical therapists, occupational therapists. I work with the medical teams. So we had mutual respect. I felt like I was teaching again, but I was teaching myself. And that was a huge help. Okay. So on to, the no television, because again, that's a lot of input. You're hearing, seeing, the light. I mean,
sound.
the sound.
You said the sound just drove you nuts.
It caused so much pain. But see, the nurse is out of habit because most people watch TV, but really that's for the caregivers, right? They just come in and flip on the TV, and I would start, but I couldn't tell you it. I just knew my head hurt.
Every time I visited, I had to tell them, turn the TV off and please do not turn it on again. That's causing her a lot of pain. And they didn't understand it.
Because they expected me to say, turn the TV off. I had aphasia.
Yeah.
That's difficulty expressing and processing language. So I couldn't tell you to turn the TV off. I couldn't. That was my response. That was my survival mechanism response. Just crying. I cried a lot, didn't I, Clay?
Until you recovered some and started cursing at them, right?
Yeah, that is true. We'll get to that. Okay, so hearing loud sounds. I was not getting any sleep. Now my sleeper, it was broken. So, but they had my room at the nurse's station. So all I heard was beep, 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 beep. All of that.
All the call buttons getting pressed, all their timers going off, everything.
Wow. People checking in and out. And then Clay, I think my coworkers who came to visit me as special education teachers, they were looking at me and they're like, Roz, you're exhausted. And I was on sleeping medication, and the pain, that didn't work. But they're the ones that brought it up.
Tramadol. They had you on tramadol.
Which is, anyways, but my co-teachers were the ones that brought it up. You know what? It's really loud here. Again,
yeah.
Because we were all trained, we looked at the environment and what kind of sensory input is our student or our patient receiving. So hearing loud sounds. So Clay brought in the sound machine. So something familiar. I'm a California girl.
Babbling brook, ocean sounds, rainforest.
But think about that. So those are familiar brain pathways that trigger pleasant feelings, trigger happiness. So we can control that. So they actually moved my room, because they can't move the nursing station. They actually moved my room, or moved me to another room that was darker, where the blinds were working. And then Clay brought in a sound machine. And Was that when they took me off? Oh, that was a part of taking me off, backing off my sleep medication, because those things worked. What
Yeah.
is pleasant to my sensory? Smell, of course, smell. So basic medical school, nursing school, PT school, the first day of school, they tell every medical student, no fragrance, 0 fragrance. It's distracting to the teacher. It's distracting to everyone else. No fragrance. Your cancer patient's going through chemotherapy. You're going to be around immune suppressed patients. No fragrance. Fragrance free. And I mean, and they are, that's medical, that's sensory 101, no fragrance. I had the best paraprofessional, and every time I had the medically fragile students, and every time she came in, my one nonverbal kid, Edwin, would just bite his flesh off. I never saw anything like that before. Come to find out, I started smelling. We cut the lights. I just started going through the sensory checklist. And all I could think it was something that we can't see, but he can't tell me he smells something and it's hurting. He smells a neurotoxin, it's hurting his brain. So he would just bite his flesh off. It was the saddest thing, but I figured it out. She wore a certain kind of popular perfume. It was a body spray, so she didn't think it was perfume. And I told her to go home, take a shower, and come back. And sure enough, Edwin, smiling, laughing, again, she was our best paraprofessional, but it was that one thing that was a barrier to his learning.
Yeah.
Which was a barrier to processing. So when you go home, everyone get rid of the candles. Not gonna go into that. That's been proved a known carcinogen, a neurotoxin, no perfume, including your detergents. Now, fragrance free, we don't think about it, but it's everywhere. And why is the fragrance industry making billions of dollars off of us, and they're producing neurotoxins?
Yeah.
You know, so if there's bad smells, there are also good smells. So surround yourself with, I won't go off on it, but I mentioned to you, I've been using essential oils for 20 years, Ralph.
Yeah.
And we were able to bring in essential oils with permission from the doctor. Again, Clay would say he would demand things, but it's not like he's yelling at people. No, you ask permission because I'm in their territory. And the doctor said, oh, that's great. And because we brought the essential oils in, which we use them at home to sleep. And that triggered that sleep brain pathway, and I was able to be completely off sleep medication. Ambien, that's what I was on, and tramadol to sleep. Yeah. Completely able to be taken off of that. The sound machine and the diffuser. And I also had the nurses taking their breaks in my room because of the diffuser. And that's how it was. That's how it was in school too. I had the teachers coming in. The principal said we should install a revolving door just so they could smell the diffuser. And you know what? They'd come in, they'd stand there, breathe in, breathe out, 3-minute break when they got stressed out, and leave. And it was a beautiful thing, because if bad smells affect our brain, then I figured 20 years ago, I also work in a homeopathic office, then good smells affect our brain. And sure enough, they do. So surround yourself with, well, get rid of the neurotoxins. Let's focus on that. And people visiting, like Clay, literally, I mean, there was no do not enter signs all over my door. And I may have mentioned before, a nurse came in on the night shift. She had her, I'm sure she started off the day with her perfume body lotion, didn't think about it because no one's mentioned it before, and she's been a nurse for a long time, so she forgot day one fragrance free. She came in I don't even know what, she came in, she talked to me. As soon as she left the room, I stroked out. Thank God two of my best friends were coming to visit. It was on a Friday. They walked in, I was on the floor. I tried to reach the call button, and that's when I fell. Tried to reach the call button. I just knew that my brain, I couldn't breathe, and it was causing vasoconstriction. I breathed in those neurotoxins. It's a chemical, so it just floats around. People don't realize it when they're around candles. It lands on their clothes. They walk in another room. Someone has an asthma attack, or someone like me has a stroke. I had a mini stroke. My girlfriends came in. They were like, Roz, are you supposed to be on the floor? I was just laying there. And we joke about that to this day, which humor is another thing. I should have covered that in hearing, which Clay, you've got 2 jokes for Ralph. All right, you stroke warriors. We forgot to start off with humor. That's essential to our recovery because laughter does good like medicine. Okay, what do you call a dirty PowerPoint presentation?
What?
Mudslides.
Okay. And number 2?
I don't bears carry a backpack.
They're unbearable.
They only carry the bare necessities.
You're on the right track.
Jeez. Okay.
Which everyone, I'm not a doctor. However, I was told in the hospital and by a psychiatrist that humor is a high cognition process.
Right.
So telling jokes, Clay said I had the stroke. I was funnier. I wasn't as funny, but when I came out of the hospital, I was funnier.
Yeah. Yeah, exactly.
Because I had no filter.
Yeah, exactly. No filter cause it all every time. Okay.
But I mean, we did meet at a comedy club, so there is that. So that is a familiar brain trigger for us. So for both of us, we need to infuse humor. So that's hearing. We talked about smell. Okay, touch. Our tactile sensory. This one, no one, because again, these are things that no one tells you in the hospital or when you get home. Let's talk about touch. So for me, because I have severe contact dermatitis, so the hospital sheets were like cardboard to me. I would break out because of their bleach that they use. But anyways, again, we're trying to create a sensory pleasant environment. Touch. So pajamas. Now again, because I didn't have a filter, I was in the hospital and somehow I was ordering pajama sets.
You did that before your stroke.
Okay, that's true.
Okay.
They all came in before the stroke. Like you were trying to get ready or something.
I know, it's really bizarre. I found some flannel pajama, 100% cotton, which is soft, flannel pajamas.
Nick and Nora,
So they were matching. So Clay was driving between states, everyone. So he would show up at the house in Plano, Texas from Louisiana, and he said there were stacks of packages. And so he just got to the point where he would just grab the packages and bring them to the hospital. And then he opened them and there were pajamas. Well, thank the Lord I ordered that because that hospital gown, no bueno. Yep. See? Look at you're having a reaction right now just mentioning the hospital gown.
Exactly. I got a bad rash.
See? thank you
Yep.
very much. And you do not have contact dermatitis. But see, that's not made, that's made for their convenience, right? For all
Yeah.
the testing, you know?
Yep.
But if we would have, just think about if you had you had your comfortable jammies, which is a familiar, again, when we can trigger familiar brain pathways, that's what gets us through the PTSD. That's what gets us through the panic. Think about, we like to touch soft things. So when you're sleeping, I mean, if that meant a favorite teddy bear, if that meant a soft blanket, your favorite pillowcase, whatever, bring it into the hospital and then make sure you have that at home. Because we spend half our day in bed, everyone, not just stroke warriors. Well, then why not make it comfortable? Why
Yeah.
not make it like a spa, right? So clothing, also slippery leather. Clay had to put, I've got my flannel sheet on this slippery leather sofa because I couldn't control my movements, right? Proprioception. My proprioception was broken, people. So anything that where I slipped, I would panic, which would cause vasoconstriction, which for me would cause a TIA, right? So
Right.
just leaning over, I would like hit my chin, fall. I mean, it was ridiculous. I wouldn't fall out of the chair, and the metal was cold. So Clay was great about this is soft. This is soft. Pajamas are soft. Tactile. I mean, pay attention to that. I would have to train my parents. The kid is scratching his skin off because those buttons, the zippers are scratchy. And as stroke warriors, I mean, I highly suggest changing your clothes. I wore pajamas to therapy. And it was great because I had these fun pajamas on, and you know who got the biggest kick out of it? The other patients.
Yeah.
They're all wearing hospital gowns, and I'm wearing my Nick and Nora sock monkey pajamas with funny dogs and cats, and they're colorful and bright. And then I'm wearing my sun hat, so I was quite not the fashionista. Right, exactly. But you know what? Talk about vision. I got rid of all black. I mean, color, which as a teacher, I dressed for my students. If my student that I was seeing that day, his favorite color was blue, I would wear blue. Why? Because that's pleasant for him. And boy, did we have great sessions. And my kids learned a lot. If I had to wear a funny hat to get their attention, I did it. Also, well, I was a kindergarten special education teacher, but really, without being offensive, from a come on, Ross, from a developmental stage, would you agree, Ralph? We have toddler brain. After a stroke, we have toddler brain.
Probably a good description.
Really, I mean, and I can say that from an educator point of view, it's toddler brain. Think about, we had to relearn. I know I had to relearn to read and write. I had to learn, I mean, touch. Okay, so food, right? Taste. Let's talk about food. If a toddler can't eat it, I can't eat it. That's the most simple way to put it. If it's easy for a toddler to eat, then I can eat it. So for those of you, for your caregivers, that was something that they talked about for me. Besides applesauce, which I cannot stand, but I had nectar thick foods, but really from a developmental point of view. Think about all of these things. If it's loud to a toddler, it's going to be loud to me. If that's not appropriate for a toddler, don't have it around.
So the food thing, it goes back to making sure that you get a swallow test.
Yes.
I mean, you want to make sure that your tongue is functioning well enough that you're not choking yourself when you're eating or drinking.
We use straws. What else? I used a sippy cup.
A sippy cup.
I used a sippy cup at one time, which was great. If I dropped it, no big deal. Again, dropping things. I mean, I wouldn't say I was a clean freak, but other people called me a clean freak, but that's because I had medically fragile students. Everything had to be sanitized and clean. So that's a brain pathway for me, Ralph. So anything, any trash, if I dropped something, I would panic. And again, panic is PTSD. We're trying to overcome through neuroplasticity those panic triggers, the pain triggers, right? Again, pleasant, calm, peaceful environment.
Yeah.
For the caregivers and for us. That's why I changed what I wore. I talk about that in my story in the Yes Stroke Warrior book.
Yeah.
I wear patterns now. That way, when I spill food, so when my left side of my tongue just stops working, inevitably I'll drool. Something will come out. That's why I do not like to eat in public. It's really hard for me anyways, but to this day, it's hard for me to eat in public. There's a, with a waitress coming in, I can't talk and eat at the same time. I still can't do it. I start choking. Clay's got something funny to say. Go ahead, Clay. When I tried, that's something that, again, back to the speech path, oh, that leads into the electric toothbrush, since we're talking about mouth. Oral health. They don't bring that up. That's low on the list.
They don't talk about pocketing food. They don't talk about how important it is to maintain oral health in the first 10 days after a stroke, because it doesn't take a whole lot for cavities to start, and they're only caring about your body, but this can have a long-term effect on your health,
your hygiene,
your and your mental attitude. Because if you have to have all your teeth pulled because you had a stroke and nobody taught you, how to care and do oral hygiene again, then you're going to have depression over that. It was a huge deal.
Yeah.
But look how we're talking about things that are connected to the brain. Look how close your nose is to your brain, your eyes, your ears, your mouth. You get an infection in your mouth that can cause sepsis. That happened to Clay's dad. He didn't get a cavity taken care of. It got infected. What do you call it? He got sepsis.
Oh boy.
To his brain, he had a heart attack. That's why oral health before the stroke and after the stroke is important. How many teeth did I have to have replaced? When I stroked out and fell, I chipped a bunch of teeth. That's how hard I hit the ground.
You broke 2.
Oh yeah, I hit the wall first and then I hit the ground. But I also had.
But they never checked for any of that in the ER. They never checked for any of that at health in the inpatient rehab.
Right. UT Southwestern, I think, is the one. Chlorhexidine. Chlorhexidine was the key. I'm like, why didn't someone, that could have saved my teeth, was the chlorhexidine, which again, oral health, that changes the way we taste our food. If your tongue is packed with bacteria, that's going to not make the food taste good. That can lead to nausea. But again, look how close all of that is connected to our brains. That's a
great point.
Anatomical reality.
Yeah.
But again, these are on the B list because they're just trying to save your life. Okay. So again, that's the PTSD. Now we're going to continue living our life at home. So these are things that we're giving you guys at 84 months post-stroke, this sensory toolbox. These are things that I wish that we wish we would have known.
And don't let the hospital or the social worker push you out of care. If you can't do something, don't agree that you can do it as soon as you get home. Don't let them, because you're only going to get the best care at that facility. When they send you home, you're most likely going to get inpatient rehab. They can't bring the equipment to your home that you can have access to in an inpatient facility. don't agree to go home until you know you have mastered whatever the task set is for them to release you. Your insurance has to pay, and just keep talking with your insurance. Don't let them talk for you. Find somebody, a family member that you can trust to have your back, and talk to the insurance company. Give them the right to speak on your behalf. But maybe you need a power of attorney, a limited power of attorney. I don't know, but make sure that you're not getting sent home and you're not strong enough, because that'll just set you up for failure and depression.
Well, and make sure that someone's with you. I don't know about you, but if I had not, like, they would talk to me, again, was a phasic, so I didn't understand. I would just say yes to
Yeah.
everything.
And
I
I
think
would have to,
everything
I would have
and
to
then
stop
he
them.
would
I'd be
have
like, no,
to-
no, 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 that's not true. That's,
Yeah.
no, we can't do that.
I mean, it was very, like, with the whole toothbrushing thing, I brought it up because it was bothering me because my breath smelled bad, and that was making me nauseous because I'm smelling that, and I didn't have dental care growing up, so when I became an adult, I saw the dentist. He was my favorite person to see all the time. And so I was very much into my oral health.
And
then
I
right
had to
when-
literally go find
yeah,
the sponge toothbrushes that weren't
Because-
too abrasive.
right, because physically I couldn't brush my own teeth.
Yeah,
So
well,
that's
that's,
right?
yeah, and the sponge breath hits the, although my left side was completely numb, it was still tingly. So if you brush your teeth on the left side, it's like this intense pain of pins and
Right.
needles.
Right.
So the
That's
sponge
exactly.
brushes or an electric toothbrush, yeah, those are great ideas. Good points.
But again, that was years after I first had the stroke. And again, how many teeth did I have to have?
9.
Nine,
Nine.
yeah,
And not everyone has. I mean, that was thousands of dollars,
yeah,
So thank God for my man. But I mean, not everyone has that. So we're telling you this now because again, vision, oral care, no one brought that up because again, they're just trying to make sure you're alive. That's their job, and then they push you out
yeah.
because
Well,
they
and the
need
other,
that.
I think there's even a seventh person that you need in there is oh shoot, what was I just gonna say? The seventh person is, we'll come back to that. I'll edit that out. I forgot.
Okay.
Anyway, go ahead.
The care, are you talking about of your medical team? Or are you talking about
Yeah,
sensory?
because with the eyes, you're gonna see a neuro-ophthalmologist. The ears,
Right.
you're gonna see an audiologist.
Right.
The nose, I don't know if you need an ENT for that, but that's something that you probably could talk to with your occupational therapist, correct?
The nose, I talked to the speech path.
Ah, there you go.
Because look, because if your nose smells something off, I mean, that's your nose and your mouth is connected.
Yeah, there you
So
go.
I talked to the speech path, plus she was the one that's responsible. She does the cognition therapy.
Oh, okay.
He was the one that recommended the swallow test.
Yes.
Yeah, and
Yes.
nobody did that for me, and I just found out within the last year I needed it. And
Right.
I'm actually seeing a speech language pathologist now.
Yeah, we talked about that last year.
Yeah, I mean, it's 8.5 years post-stroke, and I didn't know I ever needed it. And I've been dealing with a bunch of issues with my mouth and throat for years, and it had to do with the stroke.
Right, and that could be an ENT. But I
Yeah.
mean, they really, they didn't. See,
Yeah, I know what the other one was that I was going to ask about was a nutritionist.
Yes, the dietitian.
Yeah,
Yeah, I had a dietitian.
yeah.
Yeah,
'Cause-
that was
Oh,
fantastic.
because your activity is so much less, but your nutritional needs change as well because
Yes.
your body's in recovery mode. So you need different minerals and
Yep.
Yep, yep. And
Yeah.
But that
definitely,
dietitian, she was on it. She was,
well,
she's the one, that's where I learned to drink and shore. Because I was losing weight because I couldn't eat. And after I punched that nurse trying to put that feeding tube in, that was off the table.
I
Could you eat in the hospital?
don't remember. Honestly, I don't remember anything about eating. I remember 6 months later when I moved to Colorado Springs and cooking with my grandson, and we ate that food. But I remember making the stuff we cooked, the Italian food we cooked was stuff like manicotti. So it was softer. I didn't eat a lot of meats and stuff, which I probably needed more protein. So, there's a bunch of differences there. That
But see, I like said that because I learned about Ensure. My dietitian sent up a banana. Well, I couldn't eat a banana, so I tried, but I couldn't when I was by myself. Oh, remember, Clay? I always had to have someone be with me while I was eating. So Clay when people would ask, my friends would ask Clay, when can we come? And he said, well, if you came at meal times, you can sit with Roz because I always had to have someone there so I wouldn't choke.
right.
You remember that?
Yeah, because that was before your swallow test. That's before you knew that the problem was with your tongue and you were.
But I
Yeah.
couldn't tell you it was my tongue. I would start choking and I was scared to choke, so I just wouldn't eat.
Yeah. Yeah.
And I
And
was losing weight, and the dietitian, she turned that around.
and it was the difficulty in eating too. Again, that skin, the pins and needles thing. And it became a habit for me. And that's why I'm seeing the speech SLP now is
The habit.
I always chew on my right side because the left side always hurts so darn bad. So now
Right.
I'm
And look
relearning
again,
that.
all
Yeah.
this stuff is connected to your brain, and that triggers that PTSD and that panic.
Yep.
And we all go into survival mode.
Yep.
And that's what that was. Wow. It's miraculous that you did not choke.
Yeah, it is. It really is.
And
Because
that's why they're always concerned that we would get pneumonia, or people get pneumonia because they don't get that swallow test and they're inhaling
Their
their own
liquid goes
mucus.
into their lungs.
Yes.
yeah,
Yes. And that's what people don't actually die from a stroke. They die from the pneumonia caused by the stroke.
well, and I always thought that I'd spit up several times, and I always thought it was because I ate too fast, which
Me
I never
too.
did. I never did before my stroke. I always enjoyed my meals, and now I was eating fast. And honestly, why was the fear in my head, about how long I'm going to last. So I always ate fast so I could go get something else done, And I always
Yeah,
thought that was what caused spitting up, but no, it wasn't. There's issues in my throat. There's issues in my face.
it's true. But
So,
that's where we learned that sausage is the softest meat. Chicken is the most difficult meat. Sausage is the easiest, and to chew your food 25 to 30 times.
yeah, yeah,
So I
exactly.
literally have to write down when I was learning to read and write. I literally would write down how many times I chewed. Check, check, check. I mean, like a toddler, I had to learn to count. I had to learn to tell time. So all that is going on. So that's why I wanted to bring these points up so we would know, so others would know
Yeah,
and learn
yeah,
from what we weren't told, for
yeah,
sure.
exactly.
I like
Okay.
that. Thank you for bringing that dietitian up. That was a game changer. I had one at UT Southwestern as well.
Yeah, I got a dietitian in my 50 years, so that helped a great deal. Great deal. Because my issue wasn't actually losing weight, but this soft foods and the crap I was eating, I gained 70 pounds.
Oh, wow.
Yeah, I
What?
used to weigh 280. About 3 years into my stroke, I was about 280, 270. So yeah,
Wow. Oh
it
my
took me to
gosh. Wow. That goes.
Were you eating out of depression as well?
yes, definitely.
Okay.
Definitely.
So
Okay.
emotional eating,
Emotional eating, yeah.
but I mean, that triggers the pleasant brain pathway.
Yeah.
Yeah.
So that makes sense. Again, that's a survival mechanism. That makes sense. Wow.
Yep.
That brings that health pendulum to the other side, because now that's creating other things. Wow.
Yeah. Well,
70 pounds. Wow.
some of the other things I think that were missing, and what they didn't tell us when we were getting out of the hospital, is what we had to deal with in our general health insurance. Obviously, you and I couldn't handle much about our insurance because we weren't all there. So, I
Right.
mean, Clay,
Thank
what
you for
was that like? I mean, dealing with insurance and that kind of stuff.
The harder part to deal with was the social worker
Oh, yeah.
that they assigned to her case, because they were so quick to say, okay, yeah, case closed, move on, when in reality they expect somebody to be at the house full time. So when they asked, hey, is there anybody going to be at the house, I should have said, no, I work full time, I'm not at the house, because that's what the state would have assigned more care. And so I didn't answer that question correctly. And technically, I was working out of state. So I should have said, no, she's there by herself.
Yeah.
And then they would have possibly assigned her a full-time caregiver, or extended her stay in the inpatient rehab.
I was terrified to go home. Terrified.
Because you had 24-hour care. And you could always
Yeah.
call on somebody. You knew that they were a nurse trained and everything. And then at home, it was just me.
Well, no, at home, there was laundry to do. I had the cats to take care of. I'm always familiar. And that made me panic.
Yeah,
we're still struggling. I mean, we're in a brain scramble. And that's why stroke warriors fall, because our brains still think that we can walk across the room
And multitask.
Because
exactly.
that's a very deep, that's a 50-year-old brain pathway.
And there's the mental health aspect of it too, that I found out years after I first had it, that I had to go get some counseling, because that thinking of I can still do all this stuff and then getting depressed because I couldn't, I had to get through all of that. So psychologist or counseling or whatever was a
Yeah.
huge benefit for me, and
Absolutely.
improving my recovery and losing my weight. So
But how far after the stroke did you finally receive that? And that was hard because, like, I didn't have emotions. So why would I say I'm depressed? I mean, because I didn't know. I
it was
literally
about
didn't
3 years.
know.
About 3 years
Wow.
in that I started getting regular counseling at least once a month.
Wow.
But there were times I was going 3 times a week. So luckily I was at the time covered under 2 insurances and it was all paid for. But
It was covered.
I
Oh,
don't
wow.
know.
That's
I don't
great.
know if I would have been able to get through it.
No,
So if you would have received counseling in the first 30 days, would you have been more apt to seek counseling after you were discharged?
Yes, definitely.
absolutely, because there's that support group. Now I had a psychiatrist. I was suicidal. Well, in the hospital. So they had me on a major antidepressant. So when the time I got to UT Southwestern, my psychiatrist came in and he says, well, you're on an antidepressant. So are you depressed? And I remember looking at him and saying, I don't know.
Yeah.
It went from yes to everything to no to everything, just like a toddler, to no to everything to I don't know.
Yeah.
And so then he had to ask leading questions, because, like in that support group the other day, Keith was asking me, Roz, how are you doing? I mean, that's such a broad general question. I'm like, how am I doing this minute, this hour, today? I mean, I was like, yeah, we'll talk to you about that, but just
That's
asking.
a very ADHD feeling of being asked too broad a statement that you can't
Oh.
comprehend it.
Yep, Clay
Yeah.
says I'm ADHD now.
Yeah, it's the
I
way
think
that
I
you
am.
process. A person with ADHD is pretty good at answering a very direct, narrow pointed question, but a broad question, our mind just starts running a mile a minute, trying to think of every possible solution.
As ADHD. But because we're alive, people talk to us like we're normal as
Right.
before the stroke, right? Because
But
you're
there's
smiling, you're laughing, you're up, you're sitting up. But mentally, they don't see that, what's going on mentally. And we're still trying to figure it out.
yeah.
Now,
Well,
I'm still trying to figure, how am I gonna wipe my ass?
what
you
do they
know?
call it? A psychological growth that you're going through like a toddler, a psychological growth. It's more or
Yes.
less, you're relearning the psychology of it all or the process of it all.
Right.
It took a while to
That's right.
relearn it,
And that takes time. And again, that's where those brain triggers really help. Sentence starters, pictures.
Yeah.
Like for me, thank God I had my coworkers, they made signs for me, pictures. And they paired it so I can order I can
Food.
order off the menu.
Because
Yeah.
you could not answer what food you wanted because
I could not.
you had no relationship to the words.
And they weren't the ones that told me I was aphasia. One of
Yeah.
my coworkers is a speech path. And when she came to visit me at home, she looked at me and she said, we worked together for years. And she says,
Yeah.
Roz, you have aphasia.
Okay. So that's when you found the speech language, right? With the when she said you
No,
had
that's when I started. That's when I started. Well, when the speech person, when he came to the house, I told him I had aphasia. I told him because that was not in my chart. I said, I
Okay.
have aphasia and I need you to help me work through that. And then I taught because I had kids who were aphasic. So then I used my own strategies. Again, the same ones that I'm saying, I changed my environment. But
Yep.
in the hospital, my friends, they made pictures because that's what we did for our kids. They made pictures and paired it with a word, spaghetti.
Right.
I couldn't tell you that was an S. Aphasia is horrible, terrific. Yeah. And the whole panic part, the whole mental part is, I know I'm supposed to know what that is, but I could not. It was a brain scramble. It was so stressful. So they would pair spaghetti with the word spaghetti. And that's what we continued through my speech path. And she added that to my repertoire, but she did not say aphasic because a doctor didn't diagnose me as aphasic. Well, that was ridiculous, but again, that would have been helpful to know. But again, that's at the bottom of the list.
Yeah. Yeah. And it's something that we need to ask, and they don't come out right out and tell us. And that's part of the insurance thing that I want to get back to in our next session, especially with the caregiving part of it. So for today, I think we'll call it a day, if that works for you guys.
Yep.
Sure.
And we'll continue to take this up in the next session. I mean, this is all fascinating to me. I want to talk in the future too about your travel kit, those kind of things that you do. I want to talk about the insurance and the caregiving from Clay's standpoint. So anything quick you want to add today for a final closing?
No, I'm good.
You good, Roz?
Yes.
Sorry to cut you off, but we'll do it as part 2 next week. This has been great.
Okay.
Yay.
Yay.
Thank you very much.
Oh, thank you. This is a
Talk to you
better
soon.
time. This is a
Thank
good
you.
time. This is a
Yeah, it
better
is.
time. Thank you. All right. Big screen next week.
Yep.